Hi, and thanks for being here. Today, our group, Dami, Alyssa, Carson, Flor, and myself, Natalia, will be presenting case study 1, which focuses on promoting mental health in a middle school setting. This case study allowed us to explore the challenges adolescents face when it comes to mental health and how schools can serve as a crucial support system. Throughout our presentation, we'll walk you through the background of the case, key issues, proposed strategies, and the outcomes we hope to achieve through our recommendations. Let's dive into the case and how we work together to promote a healthier and more supportive school environment for students. This case study takes place at Samuel Edwards Middle School, an urban public school in Chicago, Illinois, with a student body of around 800 students. The priority population here is students in grades 6 through 8, the majority of whom are Black and Brown youth. We focused on this population because middle school is a critical developmental stage, emotionally, socially, and academically. These students are dealing with rising rates of anxiety, depression, stress-related absenteeism, and disruptive behavior, all of which have been linked to affect their academic performance and overall well-being. There are several root causes that contribute to these mental health concerns, some of which include academic pressure, family instability, and exposure to community violence, all factors that are deeply connected to systemic inequities. Key stakeholders in the setting include not just the school's administration, but teachers and counselors, as well as parents and the students themselves. Each of these groups play an important role in shaping the environment and supporting mental health efforts. This slide highlights the population and setting, as well as the key challenges and equity concerns we identified in the case. We're focusing on middle school students in grades 6 through 8 at a public school in Chicago, again, where the student body is predominantly Black and Brown, a population that often faces layered social and systemic barriers. And the challenges for them are pretty significant. So, around nearly 40% of students report feeling overwhelmed on a daily basis, 25% are skipping class due to stress, which shows a clear increase in disruptive behaviors, declining academic performance, and external stressors like community violence and family instability. From an equity standpoint, we can think of this situation as especially troubling because there's only one counselor for 800 students, which is far from anything adequate. Mental health resources in the community are extremely limited, and even when they are available, barriers like transportation and finances make them hard to access. And of course, there's always systemic inequities in the background, like underfunded schools and racial disparities in healthcare access. These are things that further limit the support for these Black and Brown students. This slide sets the stage for understanding the urgency and the complexity of the mental health crisis in the school environment.
Let's explore the key theoretical frameworks that informed our mental health intervention strategy. First, the social cognitive theory called SCT. This framework emphasizes the role of self-efficacy or students' belief in their ability to manage their stress effectively. It also highlights observational learning, which is particularly important in middle school environment. Students often model behaviors they see from teachers or peers, so promoting healthy coping strategies in visible ways can have a ripple effect. Next, the theory of planned behavior. Here we focus on three core components: attitudes, subjective norms, and perceived behavioral control. Attitudes specifically changing how students perceive mental health by reducing stigma. Subject norms is recognizing the powerful influence of peers and teachers on students' behavior. And lastly, perceived behavioral control ensures students feel they can access and utilize mental health resources. Now let's look at how these theories are applied in real programs. The Minder program, grounded in SCT, uses teacher modeling and praise-based reinforcement to help students regulate their emotions. The result: lower anxiety levels and better coping skills. On the other hand, the Teen Talk program draws from TBP, encouraging peer support and open dialogue to reduce stigma and boost help seeking. This has led to measurable improvements in mental health engagement and reduced absenteeism. Bringing this back to our case study, we saw that self-advocacy and peer support were especially effective in tackling stress and stigma. Both mindfulness and peer-based models address the emotional and developmental needs of middle schoolers, making them well suited for this population.
In these needs assessments, we're highlighting the mental health challenges facing students at Samuel Edwards Middle School, a population made up primarily of Black and Brown youth in grades 8 through 8. We're seeing a concerning rise in anxiety, depression, and stress-related issues among the students. These mental health struggles are showing up as chronic absenteeism, drops in academic performance, and increases in disruptive behavior in the classroom. Several factors contribute to this situation, such as academic pressure, family instability, and exposure to violence in the community are also major drivers. To support this need, we'll pull from several reliable data sources, such as the national data from the CDC's Youth Risk Behavior Survey, which shows that mental health issues among adolescents are rising at an alarming rate, including increased anxiety, depression, and even suicidal thoughts. Reports from the Illinois State Board of Education shows that students across the state are experiencing poor mental health outcomes and that access to behavioral support in schools is often inconsistent. Luckily, also the Chicago Department of Public Health emphasizes that urban communities, especially those with large Black and Brown populations, face significant barriers in accessing mental health care. And finally, the National Institute of Mental Health reinforces the importance of early school-based interventions, noting that timely support can help prevent long-term consequences from mental well-being. And together, this data paints a clear picture that the students need targeted, accessible mental health support now more than ever. Based on this needs assessment, our ultimate goal is to create a more supportive and mentally healthy school environment here at Samuel Edwards Middle School, and we want to reduce stress-related behaviors and foster emotional wellness, while also boosting academic engagement for the students in grades 8 through 8. To move toward this vision, we've set a concrete objective. By December 2025, we aim for at least 90% of middle school students to participate in classroom activities that include teacher-led mental health strategies, and this might include things like mindfulness practices, emotional check-ins, or structured discussions around coping skills. We'll measure our success through a combination of student surveys given before and after the program, as well as behavior tracking logs maintained by staff. These tools will help us assess both emotional well-being and any reductions in stress-related incidents in the classroom.
So, the intervention strategy that we would like to propose is called Guiding Minds and Nurturing Hearts. We would like to give kids teacher-based lessons to help kids with mental health issues as well as generally helping kids learn about how to take care of their mental health. Bottom line is this: we do not want to add extra burdens on kids, teachers, or parents to do this. So while they are in classroom, we will utilize those times so that kids can learn, the skill sets while they're in school. Also, teachers do not have to make extra time for it. This intervention will allow teachers to feel confident in their ability to help students with mental health issues and prevent disruptive behaviors in classrooms due to undiagnosed mental difficulties among some kids. Most importantly, teachers are with kids at least 7 hours a day, so they can be the first responder to kids' needs. So the instruction will be very effective if it's, directly from their teachers who can relate to their kids. So here's a action plan for teacher-led instruction that we will engage in teacher and kids in the classroom. So first of all, we will provide everything, including training and dedicated time school, schedule, and classroom space. Sometimes, instructor for course for teachers so that they can provide, various types of lessons, including coping mechanism, mindfulness, self-management, relationship building, or how to seek mental health support in their community. So responsible party will be instructor and teachers, and timeline will be 6 months. We are going to spend 6 months to provide those trainings to teachers so that they can bring those trainings to the classroom for their kids. So resources that we will need: dedicated time is school schedule, dedicated classroom space. We need to pay instructors and course materials, and we need to find an instructor for course. So this activity is expected to provide competency for teachers to lead classrooms with mental health curriculum, so that it's not too much for them to create a schedule or a curriculum. We're just giving them tools that they can use to teach their kids about it. So secondly, we will work with students and teachers on mental health curriculum. So we will involve school for this. So we are not going to give teachers all the extra burden or all the extra work on, on their plate. So we will continuously develop a curriculum materials with schools. So we will, we will be expected to have a set of mental health curriculum for students to bring down their level of destructiveness in a classroom. Lastly, one of the things that was mentioned in the intervention strategy slide was that we want this intervention to not stop in the classroom. We want to make sure that that's just the beginning of helping these kids. So we will provide referrals for students who are experiencing mental health issues. So school teachers and parents and social workers, community health workers, they will continuously monitor the kids. And when this teacher-led instruction is given to the students, if teachers feel like some kids actually need help, we will connect them to the therapist and mental health counselor so that they can get further support. So this activity is expected to provide very impactful outcome for those students who are experiencing mental health issues, academic disruption, and everything like that. So all of this will support our teachers and kids, especially kids who are having delay in academic accomplishment, as well as being focused in a classroom.
My name is Alyssa Mounts. I will be presenting our logic model and evaluation plan for our program. This slide presents a graphic on how the program will be set up and delivered to achieve our goals. The financial support will go towards instructor pay, course materials, and ancillary expenses to hire and train the instructor, create our course programming, and create the surveys used for program evaluation. This will then allow the team to have a competent instructor to deliver the intervention, create program that aligns with our objective, and allow us to show the program evaluation at the conclusion of the school year. Parental consent forms that are distributed and collected are needed to allow the team to define the population that will be impacted by the instruction. Dedicated time and classroom space allows for the course to be implemented and to reach our defined population, the children participating in our program. Administration of the pre-intervention survey establishes the baseline for evaluation data. The course instruction will then be administered to the defined population to increase the knowledge and skills of students to better their mental health and behavior. The post-intervention survey and behavior logs tracked by school teachers are the final pieces to determine if the intervention was able to meet its goals. With a competent instructor delivering course programming that is backed by research, 2 children with parental support for the program, and effective tracking data to show its effectiveness, this program will be set up to have 90% of students receive the course instruction, increase their knowledge and use of coping skills and mindfulness strategies, and increase the knowledge of requesting mental health, decrease perceived stress, and decrease in disruptive behaviors in the school to improve the mental health of students at Sam Edwards School. As previously discussed, the pre and post surveys will be utilized to determine the effectiveness of the program to increase knowledge and skills of the children to better their mental health and decrease behavioral disruption. The summative evaluation will be used to measure the results of the program. Success of the program will be measured with 3 items from the survey results. The children will be able to identify 3 coping skills, 3 different mindfulness strategies, and report decreased stress. A behavior log with teachers' counts of disruptive behavior will demonstrate improved, stable, or decreased disruptive behavior after the program.
Hi, my name is Carson, and this is our conclusion. Our goal with this program is to foster a supportive school environment that improves emotional well-being, reduces stress-related behaviors, and promotes academic engagement among the students at the Samuel Edwards School. Our objective with the implementation of this program is that by December of 2025, 90% of students in grades 6 through 8 will participate in teacher-led mental health education activities, improving upon their emotional well-being and reducing behavioral incidents as measured through surveys and logs. And so we'll use these surveys and logs to get responses from the students about how they're feeling after going through the program. Our recommended actions to implement this program are implementing a school-wide teacher-based mental health curriculum, incorporating mindfulness, coping strategies, and self-management skills delivered during regular instructional time. And then our evaluation for our program will be summative, comparing pre and post intervention survey data and behavior logs to assess student mental health knowledge and stress levels, as well as classroom behaviors before and after participating in the program. And then we have 3 performance measures that we're going to use to evaluate the effectiveness of our program, and that would be achieving 90% student participation in the mental health curriculum, increased knowledge of coping and mindfulness strategies, and decreased student-reported stress and disruptive behaviors.